In fact, sometimes the state of the product actually had to be simpler in some ways in order to get through that very limited delivery capacity. And now we're getting to 86% of the world's children with vaccines. It was about 70% when we got started. So that's a good increase. We still have 14% to go.
Well, Bill and Melinda have amazing convening and persuasive powers as well. So, I mean, they bring something far more to it than just money. I mean, they work incredibly hard. I'd do my 3 children in their foundation, but they work incredibly hard at getting governments involved in vaccines or whatever it may take. And that just is, you know, it's an extra dimension that I think very few people have in the field.
Yeah, I mean, it's a hands-on
well,
travel too.
When Melinda is in Africa and she's holding a little baby, I mean, she is actually thinking, you know, this kid needs to be vaccinated, has a decent chance in education, all that. I feel the same way about the kid, but what I really think is he's going to pee on me, you know, can I hand him something? So you know, there's just a difference in that human touch that makes a big difference.
I'm halfway in between.
Yeah, I think he's closer to me, actually.
Number 1, number 3, and number 4. First 1, then 3, then 4.
Hi, I'm Madhulika Goswami at the Columbia Business School. If the current government were to ask for your advice on immigration or healthcare reform, what would you recommend to them?
Well, on immigration,
Yeah.
Immigration, I mean, this country is built on it. I always say to people when they're anti-immigration, you know, let's put it in retroactively. You know, everybody leaves. It's this country, if you think about it, Bill's heard this before from me, but we are sitting here in part because of 2 Jewish immigrants who in 1939 in August signed the most important letter perhaps in the history of the United States. And you can go to the internet and go to search Bing. And, and just type in Einstein, Roosevelt, 1939. Leo Szilard and Albert Einstein, 2 immigrants, came here. They came directly from Germany. Szilard came from Hungary before that. And they told President Roosevelt that the Germans were likely to develop an atom bomb, which was likely to work. It's less than a full page. And we better get to work on something fast. And that the Manhattan Project came out of that. And if it hadn't been for those 2 immigrants, then who knows whether we'd be sitting in this room.
Immigration?
I'm gonna let him handle it.
Yeah, no,
you knew Andy Grove. You know, I mean, just go up and down the
exactly.
line. I mean,
right.
This country
has been built
has been blessed by immigrants, and you can take them from any country you want, and they've come here, and they found something that unleashed the potential of the place where they left did not, and we're the product of it.
The question also was about healthcare. What can you tell us about healthcare that you think is important in terms of the consideration of what might happen? I mean, if you were building a healthcare plan for America, what would be the elements that you would want to include?
Well, there's no doubt that in order to provide decent health care, the percentage of GDP devoted to it is going to go up over time. It's already very high, and yes, there's some efficiencies to be gained in that 18% or so number. But as society ages, as we come up with new things like joint replacement and organ transplant, which are going to create lots of human benefits, we're going to have more resources overall, including more government resources for healthcare. And so it's a tough problem because you have both access